I am Dr. Ayyapan. I am a plastic and cosmetic surgeon specializing in lasers, hair transplantations, cosmetic surgery and reconstructive plastic surgery. Wound healing has been my passion, and I have been innovating the bone marrow for wound healing, and I was the first plastic surgeon to have used this procedure for wound healing. Well, the passion for wound healing led me to hyperbaric oxygen therapy. I'm a plastic surgeon who was trained in burns, facial-maxillary injuries and hand injuries during my residency, and we had umpteen number of situations where the healing was not progressive. It stops at a certain point. Well, hyperbaric oxygen therapy is not a recent advance. It is quite old. It was previously used to treat pens and also carbon monoxide poisoning. In fact, it was spoken of as a treatment in search of diseases. Well, in the hands of a plastic surgeon and a wound healing specialist, hyperbaric oxygen has a major role to play, because you know exactly when to use it and when not to use it. If you have a hammer in your hand, everything will look like a nail. Hyperbaric oxygen should not be used indiscriminately in all kinds of patients, because its value is where there is decreased vascularity and decreased oxygen supply, which is hampering the progress of healing in reducing tissue edema. And you will be surprised in certain cases of burns where normally the antibiotics are resistant to the organisms becomes sensitive following a course of hyperbaric oxygen therapy. This is not documented as yet. It is anecdotal, but I have found in my experience even Pseudomonas which were insensitive to the regular antibiotics which we were using based on culture sensitivity, after course of hyperbaric oxygen therapy, the same organisms become sensitive and they yield better results. Hyperbaric oxygen in the hands of a skilled surgeon is an excellent tool, but the indiscriminate use of it in all indications leads to a lot of misuse and wastage of resources. Hyperbaric oxygen I am using now in not only wound healing and burns, but also in hair transplantations, rejuvenation of the face, as a post laser protocol. Well, there's umpteen indications. It depends on your imagination and your knowledge of the basics of physiology of the tissues. In my view, hyperbaric oxygen is an excellent tool if available in the armamentarium of a plastic surgeon. In cosmetic surgery practice, I have found hyperbaric oxygen therapy to be extremely useful following hair transplantations, and I routinely use hyperbaric oxygen therapy in those patients who are affording after liposuction and tummy tuck. The results are much better than without hyperbaric oxygen therapy, because the post-operative edema is reduced, and secondly, the vicious cycle of increased venous pooling, pressure on the microvessels is relieved, and there is better circulation. So there is faster and better healing, and I think even in terms of scar formation and the ultimate results, it makes a huge difference. I just use it for 3 to 4 sittings in the first 3 or 4 post-operative days. And another area where I have found hyperbaric oxygen to be extremely useful in plastic surgery and cosmetic surgery practices after breast reduction surgery. the flaps are extremely soft and the amount of scarring also is surprisingly much lower. So the use of hyperbaric oxygen in reimplantations and failing flaps are well known, but these few indications I have found in my private practice to be extremely useful. Thank you.